hope that was when he was asking for my address and I gave it to him.
Yeah, I got that one. No, it was
Something else?
with the FAC. I don't know.
Oh.
And their address.
Oh, I can get you that easily.
Okay, let's go ahead and call this meeting to order. We'll start off just with a pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay,
You got up there pretty close, didn't you?
well, with a little help from my friends, yes.
Thank you, everyone, for being here. It's good to see everyone here. Cicely, if you want to do a roll call for us.
Committee Member Horton,
Here,
Committee Member Grenz,
here,
Committee Member Knowles,
here.
Committee Member Jones, here, Committee Member Schumacher, here, Vice Chair Dalton,
Yes, here.
and Chair Ray is absent.
Oh, we do have our guest speaker coming up, so. Take a minute, if you would, and take a look over the minutes and see if there needs to be any corrections made. If not, then I'd look for a nod to okay those.
I'd move to approve.
Yeah, I'll second that. I read them the other day.
Okay. Rest of you fine with that? All in
Yeah.
favor? Aye.
Aye.
Opposed? Okay, minutes have been approved. Are there any visitors out there besides Todd? I guess not. So can you hear us, Todd? Maybe not.
Not yet.
He's driving.
Yeah, he's driving as well.
Looks like he's driving.
He does that all the time. Really, he'll talk while he's driving.
Okay, well, no visitors, and we'll just wait for Todd in a little bit. We'll go ahead and just get into the old business. The health fair update, as of this morning, I sent off number 40 of the applications for the health fair, so I'm pretty much done with that. I got some about 4 or 5 local ones I need to just follow up because addresses have changed and staffing has changed. So and that's pretty much it. Like I said, the tables are secured. Actually, I've got 6 apps back already today, so I was quick this response because it's usually you wait till a week before and then they start pouring in. But everybody was excited to come back this year, so that's kind of good to see that moving forward. Next item on there is the FAC update. And Larry, I just ask you to maybe talk a little bit about the FAC and what's going on with the group.
Well, I think I can't remember. Sorry, I can't remember. That's not unusual. I can't remember if I reported this at the last meeting or not, but FAC has been invited to present at the National Conference on Homelessness in Washington, D.C. in July. That's quite an honor for a small little facility like FAC. Actually, Candace will be the director. The director, Candace, will be going along with the mayor, or not the mayor, the city manager and police chief, Jason. So the two of them will be actually going in July. I'm not for sure the exact date, but they have been invited to present a 45-minute program on FAC at a national conference.
I was gonna say, how did they get the invite? I mean, no.
Well, the Oregon Health Authority, we have been working very close with them over the last year, and they've been very impressed with what has been accomplished there at the site and in our community. And it's going to give Sweet Home a really big opportunity to be on the national stage. So it's quite an honor.
Yeah, it's still in the news all the time, that particular homelessness issue out there and people that are displaced. I see it on the news all the time. It is quite an honor to see Little Sweet Home being asked to go at that level of notoriety, you know, and be heard about. So that's should be very proud of that happening. A lot of people worked hard to make that, including yourself and others. So Congratulations
Well, it
to
all started
everyone
with-
involved.
It all started with this committee. If this committee had not been involved in taking this on as a health issue in our community, we wouldn't be here.
Yeah, I remember
So-
in the beginning when we first met, you know, there was just a few of us at that table, and then it just slowly kind of evolved over time and got some ground.
Well, as,
started covering and-
as people heard about it, we started hearing all the negatives about how bad things were. And, we finally said, well, let's try and solve that instead of just complaining about it.
Yeah.
And I think we've come up with a pretty viable solution that, the Oregon Health Authority feels like it can be duplicated pretty much in any small rural community.
Yeah.
But it takes teamwork, and that's what this has been. It's been a teamwork between the city, the county, FAC, the community. Our community has put, I don't know how many hundreds of hours of volunteerism to make this thing all work.
Yeah, I remember
So-
the rock throwing in the beginning of this process, but I must say now I have not, you don't hear a lot of that talk out in the public much anymore. I mean, occasionally, but you just don't hear it. So hats off to everyone that's made that possible.
Well,
and just
and-
build upon it.
So some of our strongest people that were against it are now very vocal
Yeah.
about how much support they have for it. So that says a lot.
Yeah, I'd like to hopefully at some point to have our police chief or that group kind of report back of what they're saying.
Next July, our next meeting in July, FAC is scheduled to come and speak. And so I would hope that Jason and Candace would both report.
Oh, absolutely.
So,
Great. Any more on the FAC? Is that it?
well, that's enough for now. The city has been cooperating quite a bit at helping us get things even better than they were. So we really appreciate the teamwork that's
It
gone
just-
on there.
It's a job well
That
done.
young lady right there has done an awful lot of rewrites and rewrites and rewrites to make things. We have done we've been very grateful for all that's been done for us.
Absolutely. So again, thanks to everyone that's took a part in that. Moving on to new business. We have the Samaritan Gerard Birth Center.
Mr. Noble's actually ready.
You on, Todd?
Yes, I'm on.
Okay.
So do
We're
you
gonna
guys
try
hear
to
me?
boost- There you go.
Okay, can you hear me?
We can.
Okay. So I'm Todd Noble. I'm the health administrator for Lynn County and which means I'm the mental health director and the public health director. And so I think I was asked to come today to tell you about our health clinic out there. Is that
Yes.
right? Okay.
Yep.
So and I'll be brief. So as you probably know, we started a partnership with Benton County and the FQHC, I think in 2014. And we did a co-location as you're aware. And I think it was last year we decided, because of a lot of it was community feedback, and certainly coming out of the pandemic. By the way, I'm sorry I'm driving. I have sunglasses on, but
Just be careful. Just be careful.
yeah, coming out of the pandemic, clearly there's never been a time in any of our lifetimes where there's more of a need for behavioral health concerns. And so part of that, once we found out talking with Benton County that they were going to be able to find another location, we decided to part ways so that they would be in their new location. Of course, access to primary care is incredibly important, and especially in East County, but they were able to do that. And so we decided that we need to bring in a lot more of our work and see about expanding our services out in Sweet Home. We've been there for many, many years, but because we had less of a footprint, because we partnered with the FQHC, we decided to come back and repurpose our efforts. So that's exactly what we did over this last year. We did a remodel, and so we've remodeled the building, and we are in the process of not only extending our mental health footprint out there, which, by the way, if you know anybody that wants to get in the mental health field, I'm happy to hire them. And we would like to get more folks out there because we do have that problem of hiring workforce is a tremendous problem for everybody, as we all know. But we're expanding out there for that. We've added our some of our adult and our alcohol and drug services out there, our SUD services, which has been an expansion because we clearly know SUD problems are a concern across the country and here in Linn County. So we're doing more groups and having more work there. And we're also putting in our WIC, some of our WIC from public health to help moms and babies. So that's basically what we're in the process of doing, is to fill the building and to increase our services from a WIC perspective, from a A&D perspective, and from a mental health perspective to better serve our friends and citizens of the wonderful Sweet Home area. So that's any questions?
Well, I guess my first question was, what's your biggest hurdle? Is it just staffing of finding qualified individuals to come in and be a part of your team?
Yeah, you know what? That is by far the biggest issue. And it's like, I know I keep on playing the same record over again and thinking to myself, when is the workforce issue going to be solved? But yes, from when the pandemic hit, we had a lot of people that retired and aged out and just retired. They'd served the county for 20 years plus. And yes, part of the issue, there's always ramifications. So the Oregon Health Authority allowed telemedicine to be billable in a way that it hadn't before. And so that was great in many ways because it increased access in lots of ways. But unfortunately, what happened for us is many people ended up leaving our work. I mean, our work is the safety net work. I mean, it is the challenging cases and the people that really, really need services. And so many clinicians left to work at home on their laptops. And I think we lost about 18 clinicians that way because they could make, 6 figures working from home. And so that has created a huge problem for us. And I have been a big vocal voice about this concern across the state. But yes, that's exactly what's happened. And so we've been trying to rebuild this last year. I believe, I have a number of openings, but it is better than it was a year ago and better than it was 2 years ago. But I could literally hire 10 to 15 people tomorrow, and I have dollars for it. I just don't have the bodies. But I think, we're not unique because, talking to my hospital partners and anybody in healthcare, a lot of people have left. And so it's a challenge. We're really aggressive on trying to, we've increased pay pretty substantially. The Board of Commissioners have been really supportive, and that's been great. I'm recruiting in Iowa and Tennessee and other places to try to get folks out here to meet the need. But yes, that is our biggest problem by far, is indeed finding more staff.
Now, are you using, I guess, the technology to kind of change that, how you look? I mean, like virtual type meetings with individuals, or are you tapping into that technology to help you?
Yeah, we are. So we've done a sort of a hybrid. So again, I think that it has its place, but I think when you're dealing with people, the people that have a severe and persistent mental illness, technology, counseling, like if I was talking to somebody right now that was doing, I'm a counselor by trade, and, that works really, really well. But if somebody is, struggling with schizophrenia or bipolar disorder, it's not the best modality for those folks. And people with drug and alcohol problems, by far the best way to do that service is in group settings. So we do some outreach for some folks with technology, but our core business is the most vulnerable, and that's kind of hard to do with technology.
Yeah. I think one of the things that, working with Dick Knowles, we've exchanged a lot of conversations over the years, but, one of the things I find is just the stigma that is based around mental health and trying to break through that barrier for people to understand that mental health doesn't, it means many things. It has many different levels to it. It's not just someone that's schizophrenic, and having people understand that we all have a certain degree of mental issues we deal with in our lives, from losing someone or divorces or a lost child or something that is part of that whole picture. And I know during our health fair that you watch the participants that come and they see the word mental health and you kind of see them just kind of stare around the table a little bit. And it's always been a challenge to communicate to people that it's different than that, and so Dick and I are always been trying to kick that can down the road is how do we break through that barrier?
Well, and that's absolutely right. And I literally take my hat off to Dick. Dick has done such incredible work for us for so many years, volunteering, and part of it is to break that stigma down. One of the things he's just absolutely wonderful. I feel just so blessed and grateful to have him part of our team, because that is just it. It is that stigma, and that stigma. This is one of the reasons years ago, we used to do all of our services for kids, for example, in our offices. And about 20 years ago, we moved the vast majority to schools. And it was for that exact reason. Let's just say you're a sixth grader, and all of us go through the human condition of having a hard day or having things in life that you talked about. And so that model which we put into effect was, if Johnny's having a struggle, it is much easier to have Johnny be seen by a counselor in school, that it's not going off to a sterile doctor's appointment, and try to normalize that everybody can benefit from mental health services. So that has actually been a major part of our approach. Now, unfortunately, the last couple of years, because of we've had to contract from schools, in we used to be in like every school, and so we're focusing primarily on folks that are in children that are in DHS custody and foster homes, and so we're not to the level where we used to be in schools. But the point is well taken. If you can just point out that everybody has challenges at time, and it's like going to the doctor. Nobody wants to be sick, but when you're sick, you go and you get fixed up, and that is a constant approach that we do. And we also know that people, for example, that commit suicide, the vast majority have never been seen by behavioral health at all. They go to their doctors, but they don't get into mental health. And so there's a good side to that and the bad side. The good side is if you're in mental health services, you're probably not, the chances are you're getting the treatment that you need. The bad news is we need to reach to the community and do prevention work so that people know, it is okay. I mean, everybody struggles. And that's one thing that we do have in Lynn County, which I will point out is, our working with prevention actually in schools, doing mental health first aids, doing all kinds of trainings. That's where you can reach people and so they can realize everybody can have a struggle at times. So that's part of our mission that we're always trying to work on. And Dick is a definite part of that.
His head's swelling up
Thank
on him
you,
right now.
yeah.
I'm gonna have to pour some water on him.
Oh, he's over. I didn't even see him.
He's
over.
right down here at the end.
I didn't know he's in here.
Well,
Otherwise, you wouldn't have said any of that stuff.
he was being pretty quiet over here as you were talking. So, no, I hear you what you said about the schools. Dick and I met with the schools probably a year or two ago, and I was astounded what I was hearing coming from the administration there that, we had third graders talking about suicide, and I just really didn't even know what to say to that, and then you figure, I don't know, what was it, Dick, 10%?
Yeah, or more.
Of the population of students there didn't have a permanent address. They were moving from home to home or wherever they could find. So some big numbers that jumped out at us, and how we can support their efforts. And you said it right. It's about prevention and getting it out in the public and up front. So, well, hats off to you. Does anyone else have any questions for Todd? You must have did a good job. They're just shaking their head no, so.
And
Well, there's-
I'm hiding.
Well, I appreciate you being here and letting us know what you're all about. And if there's anything that our committee can do to help support you, you let us know.
All right, well, I really appreciate it. And thank you for the
Todd-
opportunity for me to come and talk. Uh-huh.
Todd, could I ask real quick, do you have a point person at the clinic that we could get a hold of if we wanted to have them come visit as well?
I'm trying to think of who's out there right now because we're in the middle of moving people around. Sandy
Yeah.
would be the best to
Yeah,
tell
that's what
us.
I would, that's the right answer. I'll just put it in her bailiwick, and when it comes time, she can introduce someone, and yeah, that's good.
Great.
Thank you.
All
All
right,
right, Todd, thank you for being here.
All right.
Thank you, sir.
Take care.
You take care.
Bye-bye.
Take
Bye.
care.
Okay. So now are we back to the Samaritan? Okay.
So I put this item on the agenda, sorry, it's caught off guard. I put this on the agenda just because I know it's been a hot topic in the community. Wanda was kind enough to send some resources that I added to the packet today, and you can just take those home. There's an article in there and then a letter from the Samaritan CEO. I know City Manager Ogden has been in touch with Councilor Michelle Steinhable in Lebanon. So we're in talks of maybe doing something publicly to take a stand as a city just to ask that they maintain those services. But I know we don't really know the timeline on closure. There was some talk that that was going to happen at a recent meeting, but it did not. So I just wanted to open that up if that was something the committee wanted to discuss, if there was anything that you want to do as a group, but just know we're talking about that at a higher level as well.
Well, I know I think it was probably day one, my phone started ringing. And what did I know about it? And it was kind of news to me. So, but I was kicking around the idea that maybe some support from our committee, the city, to a letter to them asking just what you had referenced, that the effects that could have on our community and the surrounding communities. So I would support that sort of direction.
Then yeah, we'll be sure to include the committee if we decide to put something formal together.
So just a little feedback. This is like the third time I've come from a meeting on the same day, and it was at noon. We had it was one of the board level meetings, and once again, the Samaritan stance is we're still working on this. We've made no decisions. With the strong point more and more being that they want to come into the community and ask what they think. So this isn't a caution, but I would guess they're probably going to contact at least Lebanon. I would hope immediately. And I would think because of the clinic, they would say something to us too. So, inviting them in here, inviting us to open up the meeting to the larger group in the community. I mean, there's a number of ways we could do this, but I had the same thought. We need to put our footprint in. The meeting I was at this afternoon, once again, the health committee came up and the support from the community came up and the new clinic. I mean, we are a part of their agenda all the time. So anyway, I would encourage you to, as soon as something happens, let Kelsey or Bob know.
And I would add that it's important to give feedback as a community. We do have community members who are on the Lebanon Hospital Foundation Board, and I would say to be sure to reach out to them if you're able. And I can speak for our clinicians who sent emails immediately because it's a big concern for us as well. So, and I can't speak for Marty, the CEO, which is why I sent this public letter that was also sent to all Samaritan staff. But I do know that no decision has been made, and I think that a decision of that level has to have a lot of consideration given, and I'm hoping that they make the right decision.
Because when I first heard about it, it was like they're going to vote in the next week, and that was a week ago. And I'm going, next week, have you even talked to the communities about this? So I was a bit shocked that they were rushing that quick, but it made me think back to when we went through the Wiley Creek,
Right.
you know.
Exactly.
That was a quick turn, you know. I went to that meeting. It was
Bad.
it was a bad meeting. And I remember standing up for that crowd and said, there's a lot of anxiety here. Let's just kind of take
Calm
the
it down a
temperature
little.
down. But when I went into that one to talk on behalf of that group, I'd actually brought Samaritan's mission statement and goals with me. And I just walked down through them. I said, well, you've missed number 1, you've missed number 3 and number 5 on your list here, which says you'll work with the city, you'll make those announcements. And that's when they kind of stepped back from that one and took recourse. So it was to remind them what their responsibility was to the community. So hopefully the same effect will happen here. So anyone else have anything or? No, I think we're good. Okay. Next item on the list is the Rotary presentation. Kelsey, Dick and myself, we attended the Rotary meeting and Larry was there and it was great to have the Rotary hostess.
Ken was there.
Ken was there. What's your take on it, Ken? I mean, I'm kind of putting you on the spot, but you know, Kelsey did a good job of providing the slide presentation she did to the city council.
Solid. Heard the message.
Yeah.
What you're doing here. So.
Put you right on the spot, man.
No,
No, I think
Kelsey did good.
Kelsey did an extremely good job. She was a little nervous, but I think mainly just hooking up the software to the television set to make sure it worked with the laptop. So,
Forever.
but we got through that, and yeah, it was good that the Rotary was hosting us, and thank you for that.
Our
to the
pleasure.
group. It went really quickly. So, and the lunch was pretty good too.
Lunch is always good.
It was good for my taste. Anyway.
You're welcome anytime you want to come.
Yeah, you just
All
want more,
of you,
you just
any
want
of
more members from us. Is what
We would love more members.
I knew it. You were catering on us.
Anytime we see doers, we want to get them as close to the Rotary as we can.
We only have 22 members, but we do a lot with the few we
Yeah.
have.
Do a lot. Okay, the next item on there was the physical therapy outreach program. And that's something I've been working on with Jeannie Davis from Samaritan. The concept behind
For the
that,
Med school.
or the med school, one of the things that we got in conversation was the students have to do 30 hours of outreach per year. And we were talking around physical therapy. And I kind of, we had a meeting last week, we talked. What that involved was, she said, well, the board for the group was kind of different. I was kind of picking up on the concern there, but I'd ask her if it would be helpful for either myself or members of this committee to go in front of that board and kind of pitch what we're asking for. Because we were looking at, Jeannie and I was discussing, I said, why are we not using the old Samaritan Clinic out front? Because it doesn't have any presence. It looks like it's shut down. And she never thought about that. But I said, I've had a lot of conversations with individuals there that are saying they would love to use the front of it. They don't need to do a major remodel on this thing. They just need the space. And they're in a position where they're actually turning people away because they don't have enough services. But the students were just a quick one for free, 30 hours to bring the students in. So we're having that kind of a conversation. That's what the outreach is about. See if we can't get some students in here with free services doing physical therapy for patients. So I think it'll be a good thing. And she was pretty excited about the idea of
I don't know what
out front. So anyway, you all right?
Yeah.
I got some water if you need it. So.
It's all that cedar you've been pounding.
No comment.
Next item on the list is the Mike Student Doctor Leadership Program.
I know a little bit about it. Rotary is going to be participating in an event that is tied in with the Mike program. Diane Lacey and Jim Gorley are working on bringing the student doctors that have been working in the schools as mentors. They are bringing the ones from Sweet Home and the ones from Portland, and they're going to do a leadership type program for them. The students are going to get to hear from a lot of local leaders as to what kinds of medical things they see are needed. Jim and Di are actually the ones that are organizing it. But it's going to happen in September. I don't have the exact date yet, but we did this same program or a similar program. Excuse me. I think it was probably 4 or 5 years ago. And at that point in time, we just had students that came with a few of the student doctors. And those kids got to hear leaders from all over the state. And it was pretty impressive.
Now, that's here in Sweet Home?
It's here in Sweet Home. What we're going to do is kayak from Shea Point to each of the docks around the lake, and there will be a student speaker or a speaker for the students at each of the docks, and they'll talk about different topics. And so the doctors are going to hear a lot of, oh, thank you. I don't know what I swallowed, but it wasn't good. Probably was cedar. I've been building a deck at home, so it's
Now, this is
got a lot of wood.
is this the same program they've done before, isn't it? I mean, I remember Jim, they actually had an aerial
Yeah.
presentation that they.
Yeah, we had the sheriffs involved
Yeah.
there. It was a pretty big
It
deal.
was the Interact kids that was our targeted group.
Part of it, part of them. It was also part of the high school mentor program.
Yeah, well, it was a combination of
Yeah.
of both those things.
Counselor Bronson, can you use your mic, please?
Can you hear me now? I said it was the Interact and the high school kids that was involved because I was that lead kayak out front. That was me.
Yeah.
Take them across.
I
So
was thinking I'd saw that. It was a great program
Yeah.
and it was a great presentation
it
the
was
way
a
they
lot of
did
fun
that.
too. So
Yeah, you could tell the excitement on the.
This
those that
time the
participated.
focus though is going to be more on the student doctors than the students at the schools. So
Great.
it'll be interesting to see what the focus actually ends up being.
And that's in September?
It'll be September. They decided that by that time the lake is not overly used and it would be a good time before it starts to drop.
Mhm.
Yeah. So
Oh, great.
it'll be in September and it's the Portland students and program are coming down to join the ones here in Sweden. So again, I think it's a really great way to
It
show off Sweet Home.
Makes Sweet Home on the map a little more,
a little bit more.
a little bit more.
We're
so.
trying.
All right, thanks, Larry. I appreciate that. I guess we're really right on down to the committee business for good of the order, the public and traffic safety.
Yes. So, as you all know, around the same time this committee was codified, we also codified the Public and Traffic Safety Committee. That committee has really struggled with number one, attendance and membership, and number two, agenda items for action. So we talked with the chair and we decided that we are going to put that committee on hiatus. But we thought, especially the public safety side, if there's anything that doesn't require their committee to convene on kind of an ad hoc basis, if we could bring that to this committee. We wouldn't bring you anything technical, but just things like if you're seeing things public safety wise in the community, because I do think public safety and even traffic safety definitely intersect with community health. So I just want to let you know, we may be bringing some of those items to this committee in the future.
Good.
No, I think that would be fine.
Yeah.
Absolutely. We support that. That's pretty quick. You don't, Adam, you have anything to say? Man, I'm rolling on it.
I want to say thank you to Adam for the water. It worked. Sawdust is gone.
First, the last item down there is just a round table. Are there anyone on this or in this room that has anything they'd like to bring up? That's like deer in a headlight look I'm seeing. Well, one thing I'd encourage all the members of this committee, I know Kelsey is always looking for input. She needs that input from us for agenda items. So I would encourage you, if you have future agenda items, something you'd like to get on this agenda, let Kelsey or myself know so that we can get that put out there for us. So I know this time she was struggling. I had a lot of ideas and she appreciates that. So, but is there anything else?
And please keep sending me your events so we can post them, because that was great for the Lebanon. So thank you.
Okay.
I'm assuming you're going to put FAC on the agenda for next.
Definitely.
Just making sure. Thank you.
Okay. If there's no other roundtable items, then we'll adjourn this meeting.
Thank you.
Yeah, I like it.
like it.